Welcome back, everybody. And as a lot of us know, Medicare is undergoing some massive changes the past few years, with some plans going away entirely and premiums increasing in a lot of other cases. So right now, it is more important than ever for people to work with a licensed Medicare specialist. And we're in luck because we have one sitting right next to us today. Welcome back, Debbie. How are you?
Thank you. It's my pleasure to be here.
Oh my gosh, well, it is our pleasure to have you here, but you're also here to ensure that we have the best plan for everyone. It's not one size that fits all. But to start off, since annual enrollment is here again, what are some key dates that people need to mark on their calendars and be aware of?
So open enrollment is right now through December 7th. But we don't want you to wait till the last minute because we want you to be prepared and not scared.
Okay, prepared and not scared. Keyword here, everybody. But Debbie, how does someone know if they're paying too much or if they're missing out on some of their benefits?
Well, you don't really know until you take a deep dive. So there could be plans out there that have way better prescription drug coverage than what you have already. There could be plans out there that don't have any co-pays to see your doctor. There could be plans out there that offer more over-the-counter benefits than what you have currently. And you don't really know until you take that deep dive.
That's right. Now, you just mentioned some of those details that, hey, sometimes we're not always looking for them. But how can a few missing details cost people money or even limit their care?
So there are plans out there that are eliminating, for example, Ozempic. So if you're an Ozempic person, chances are you could wake up on January 1st and not have coverage and have to pay full price for that Ozempic. There are plans out here in Michigan, 73 plans are being completely eliminated. So you could wake up on January 1 and not have a plan, and the company is not going to help you move to another plan. So it's important that you read everything you get through the mail, but if you don't want to do that, just call us because there's no charge for our services ever. We guide you in making those decisions, and we're also there when you get that bill on your kitchen table and you don't know what to do.
That's right. Well, I was going to say the next step is to call you. But what information should people have ready and on hand when they want to make an appointment?
Super easy. You probably already know this off the top of your head. So grab a list of your doctors, a list of your prescriptions, your favorite pharmacy, and any other specialist or dentist that you see. And then we're going to take that information and make sure you're in the right plan. And if you're not, we're going to help you look at some other plans. But you know what? The choice is always yours. But we're encouraging people, don't do this on your own. There's no charge for our services, and you always want us in your corner. Again, when you get that bill, we're there to help you through it.
That's right. And how important is it to work with someone local when you're choosing a Medicare plan?
That's really important. So we are local here in the state of Michigan. So we understand all the big national carriers, those commercials you see on television. But I also know all of the local plans, and those local plans might be a better fit for you.
That's right. Well, Debbie, you have clearly shown us that you are looking out for us. You know the plans like the back of your hand, and you can take away all of that confusion that we have. So take a look at the screen below. You have all that information there to contact Debbie and Legacy Partners. But otherwise, thank you so much for just explaining and laying all this out for us.
It is my pleasure. And you were talking about the most wonderful time of year?
Yeah.
Medicare open enrollment is the most wonderful time of year.
That is right, and you heard it here first. Thank you, Debbie. But there's more Studio 10 straight.